COVID-19 related matters now. The COVID-19 pandemic is taking a toll on our healthcare facilities, and frontline healthcare workers witness it all firsthand. Desperate patients seeking help, and some even ultimately succumbing to the virus. This surely has some lasting effect on the mental health, which can lead to post-traumatic stress. So we talked about this more and around even how we can help our healthcare staff cope with this outbreak. We're joined now by Dr. Alicia, psychiatrist and healthcare workers care network coordinator at the South African Depression and Anxiety Group. And we've also got Dr. Caroline Leaves, an anesthetist as well as wellness coordinator at the South African Society of Anesthesiologists. Thank you so much to the both of you for joining us this evening. Dr. Alicia, let's start off with you. I mean, COVID-19, when it started last year, we had to go into that hard lockdown. Frontline workers were praised time and time again for putting their lives on the line to save our life. But I'm sure at one stage or another, fatigue kicks in, as we saw even last year. How are healthcare workers handling it this time around with the third wave, with the Delta variant that is proving to be much stronger than what we anticipated?
No, I think that the third wave has definitely brought with it a level of exhaustion within our healthcare workers. I mean, just manning the requests at our the healthcare workers care network, we're just finding that there's an increasing number of requests for help. And you know, our South African healthcare workforce are a resilient bunch of people. I mean, I don't know that anywhere else in the world you'll get healthcare workers that are as resilient. But I do think that the third wave has taken a toll on our healthcare workers with regards to, you know, just exhaustion, burnout. There's definitely increased rates of anxiety, depression. And what we all call, or what we're seeing, is moral injury, you know, just having to make or not make decisions, and this can cause, you know, psychological distress as a result of having to make life and death decisions with such poor resources. It definitely compounds the trauma that's already being experienced.
Yeah. Dr. Caroline, I want to just speak about health and wellness for a second. I mean, we understand that our public healthcare infrastructure is just overcapacitated. Some of them don't even have the necessary resources. This places a lot of pressure on the healthcare worker. So in light of that, the fact that there is a lack of resources, how much mind is paid to the overall wellness of the employee, or in this case, of the nurse or the doctor or the healthcare professional, which has to tend to many of us during this time?
To correct you, I actually work in the private sector. So even within the private sector, we are resource restrained at the moment because of the massiveness of the surge in Gauteng. And so even within the private sector, it's difficult to maintain the or look after the mental health of our workforce, because I mean there is just no time. Everybody is expected to work as much as possible, work beyond their hours even, because there is just not enough people to carry the load. And I'm sure if it's that bad in the private sector, I'm sure it's a whole lot worse in the public sector.
Yeah. And we're staying with the theme of the private sector, though it may be a little bit better resource than the public sector, but is there time to pay you know, any form of concern to health and wellness, to ensuring that indeed the staff members have got some kind of morale booster from time to time? Or is it just about saving lives at this stage?
I think at this stage, the surge is so massive that we are really just, hopefully, just on top of that peak for the third wave. So at the moment, there's really no time. So in between the second and the third wave, there were things put into place to look after the mental health. But we were, even though the numbers of new cases were low, the ICUs and the hospitals were really busy between the second. I don't think we've stopped since January this year. The structures are in place, but I don't think anybody had the time to access it. And also, the hospital has given sort of consideration in that their work hours are sort of a little bit better. They have a longer break time just to get out of the PPE, because it's very, very difficult to work in PPE for those long hours that they have to work. So there are things that are done, but during the peak, it's just impossible to implement, in fact.
Yeah. Dr. Alicia, do we risk healthcare professionals suffering from PTSD as a result of the realities of COVID-19?
I mean, I definitely think that there is a significant risk, because this is a traumatic experience, you know, the uncertainty of it all, the duration of it all. You know, so it definitely is going to increase the incidence of post-traumatic stress.
And are you seeing any sort of healthcare workers seeking the help of the South African Depression and Anxiety Group, whether from, you know, suicide or depression or even anxiety as a result of just some of the realities that they're confronted with on a daily basis?
I mean, we're definitely seeing an increase. So that was one of the reasons that the Healthcare Workers Care Network was established, to support healthcare workers. And yes, we are seeing healthcare workers reaching out for help, but it has been quite challenging, because there's a narrative among healthcare workers. You know, there's this superhero narrative where it really is being difficult to ask for help or ask for support. But we're definitely seeing, with there being an increase in awareness of mental health conditions, mental health concerns, there definitely has been an increase. I mean, within our organization, you know, we must have reached about 300 healthcare workers with almost 400 hours of therapy. We've trained over 4,000 people, or 4,000 people have attended our trainings. So there's definitely an increase in awareness, and that was the work that was done initially, because ours was a two-tiered approach. It wasn't just about crisis intervention. It was about how do we boost resilience within healthcare workers, or how do we begin to prepare healthcare workers for what was coming, not necessarily what might have been at the time. So that was a lot of the work that went in initially, and now we see, you know, with the crisis intervention, with the psychological support that we are offering as an organization.
Yeah. And Dr. Caroline, I mean, as we're looking at the figures of COVID-19 right now, we've just seen a report coming out from today, 21,000 infections. Unfortunately, more people have succumbed to the virus in itself. Just in terms of being able to cope, one would say, if we had to get practical this evening around how healthcare workers can manage and cope the stress that they have to deal with, how do we get practical? What should they do?
I think the main thing is to don't close in on yourself. So at the moment, you know, we are seeing obviously a lot of people that succumb to it. This Delta variant is certainly a lot worse than prior waves. So we are seeing a lot more families that come and get admitted together and pass away and that type of thing. And I always tell the healthcare workers, the nurses and the doctors, that don't keep it in. Actually, we huddle together, give each other hugs, and cry, give each other some time, 5 minutes just to cry, and just even pray for the people that we've lost along the way. And it is more than one or two a night sometimes, in a bed next to each other sometimes, you know. And we also try to help each other be more supportive of the patients, so that we teaching them to find meaning in it, not just being the healthcare worker, but actually, even if we can't save their lives, we can make their last hours a bit more meaningful for the patients, so that we feel that we're actually doing something. Because there's a huge sense of helplessness when you actually run out of resources, you run out of ventilators, you run out of beds, you run out of everything, and the only thing we can give them is care, and loving care, not only to the family, the patients that are in those hospital beds, but the family members, as well as to the nurses that have been looking after them.
We'll leave it there for this evening. Thank you so much for your insights, Dr. Alicia Porter from the South African Depression and Anxiety Group, as well as Dr. Caroline Lee, who represents the Society for Anesthesiologists. While still ahead